My pharmacy exemplifies what I guess best practices of what a behavioral health pharmacy should be. The quality controls we have in place, the compliance, with both Joint Commission and state regulations, and my focus on patient care and patient care outcome. My philosophy about medication is, well, I really feel like we all have a lot of control over our lifestyle choices and ways that we can impact our health that is not just medication related. How much sleep we get, our diet, how much exercise we get, whether or not we have a good support group and someone to talk to. These all play a part in our mental health and are important, as well as medication. We want to, sometimes medications are needed, and that's fine and that's okay, and that's what we want to do, but we want to work closely with the patient to make sure that they are, we're at just the right dosage, where it's not causing side effects that the patient doesn't like, but also gives us the therapeutic effect that we desire. Well, some people have the misconception, they think that medications are a magic bullet and they will immediately feel better. And that is not always the case. Some medications can take a few weeks to build up in your system. Another misconception people have is if they have a side effect, then that means that they don't want to take it anymore. And some side effects are very manageable, whether or not you take a medication with food, whether you take a medication in the morning or at night, are all important roles in helping manage your medications. Obviously, medication plus counseling, medication plus being in a support group, plus lifestyle choices gives patients the best outcomes for their mental health. I have been fortunate enough to win some awards over the course of my 10 years here at Glen Oaks, and I'm very proud of those. It's wonderful to be recognized for what I do here. I play a large part in medication management and patient safety. I take it very seriously, patient health, and playing a huge role in that. But I also, it's very important to me to make an impact on patients, a positive impact on everyone who I interact with. But I also play a role in patient education, both inpatient and both after they discharge. I help patients with questions when they call the hospital, with prior authorizations, with refills. I've had many conversations with caregivers and patients after they've left the hospital. So I take on some additional roles just because I'm passionate about, if I can make a difference in the life of somebody else, I want to do that. But it is wonderful to be recognized for that as well. And I did also, in 2020, I won Site of the Year for a CPS pharmacy, which was very special to me. To me, what makes a pharmacy is a pharmacy that's able to make an impact. When I first wanted to become a pharmacist, it was to make an impact in patient care. I did spend a lot of time in retail, and I didn't feel like I was able to make that impact as much as I am here at Glen Oaks Hospital. I'm able to communicate with the doctors, with the nurses. I'm able to change practices that might work better for our patients. I'm able to impact care in a very tangible way. And that makes me feel very good about what I'm able to do here at Glen Oaks. My why is knowing that I have made a positive impact in the life of somebody else. And I get to do that every day.